in through the nose, out through the mouth, in, out. Great, now let's get ready for transition labor.
Oh.
Come on, girls, let's do our hee-hees.
Oh, let's not.
Grumpiness and irritability are good signs in women over 37 weeks. It means that you are psychologically ready to give birth. Whoa!
It means you can't remember when you weren't pregnant and you can't imagine when it's going to end.
Swollen feet, sore back.
All right. Let's skip the hee-hees and we'll adjust our pillows and get ready for our total body relaxation exercise. And then when we're done, we'll have some protein cookies. Whoa! Right on.
Oh, I don't know what's worse, her attitude or her cookies.
Is she always this grumpy?
Colleen? Only when her husband's not here.
Well, your husband's not here and you're not being a grump?
Yes, but he's a flyer and so is your ex, so I can vent to you any time about the Air Force and you'll understand.
Separation, lack of family life, transfers of good friends.
Now who's grumpy?
I'm not being grumpy. I'm bitter.
All right, here we go. Now, breathe slowly. Exhale. I want you to put yourselves in a place of peace. Imagine yourselves beside a mountain stream or on a sandy beach.
Skinny, in a bikini.
Hold it!
Can I help you, sir?
You better. One of you's having my baby. And I want to know who. And if you don't tell me, I'm gonna blow us all up. All right, you. And you, 2 men. Get out.
Not a chance.
Mr. Clancy.
Yeah. You're making my thumb twitch. You don't want to make my thumb twitch.
You can't ask these husbands to leave their wives.
I'm not asking! I'm telling! If they stay, they'll try some road, and then they'll kill us, and this whole day is shot to hell.
Maybe you should do as he asks.
Please, Roger.
Yeah, please, Roger.
Anything happens to my wife or child, and I will find you and kill you with my bare hands.
Yeah, yada, yada, yada. Now you proved your manhood, get the hell out. And tell the cops to disappear, too. Men in blue, they also make my thumb twitch.
Look, why don't you go across the street to Community General Hospital? Look for Dr. Mark Sloan. He'll help.
Hey! Hey! I got the bomb! I get to give the orders! And who's Mark Sloan? And turn off that idiotic noise! Now get out! Get out! Go! You! Go! Come on, dear!
Mark Sloan.
Mark?
Hi.
Mark, I have a problem.
Your friend Juliet decided to go into labor right in the middle of the class.
Well, no, but if a man barged into my childbirthing class with a bomb strapped to his chest, I might.
Bomb?
Yes. Mark, do you know a Dr. Adam Embry?
Yes, he has an office here.
Okay, well, this man with the bomb, Bob Bear, he says that Embry's a fraud and that Embry gave away his sperm without his consent.
What?
And furthermore, he is absolutely sure that one of the women here is among his donees.
So he decided to blow them all up? That makes sense?
I didn't say it made sense, Mark. What I'm telling you...
It makes perfect sense.
What, holding a bunch of pregnant women hostage?
Making sure I get my answer.
I don't quite understand.
Well, then try this. Lorraine and I. Lorraine is my wife. We tried everything we could to make a baby. We tried the cycles, we took temperatures, we did a variety of positions, 5 years of nothing.
So you went to Dr. Embry?
Right, the creator of families. And that's what his brochures say. But all we got was gift and zift and surgeries and drugs and IVF and 2 more years of useless procedures.
Well, look, it isn't an exact science. You know, some of the very best practitioners only get maybe 40% success rate.
Yeah? Well, his success rate was much higher because he gave my sperm to other women. One of these women. Now, he stole my seed, and I have a right to know who's got it.
All right, look. You let those women go, and we'll go have a talk with Dr. Embry.
No, he'll just come down here and lie, and everybody will believe him. You get that bastard on the phone, or his live birth success rate's going way down.
I'll do the very best I can.
That's right. You will. As long as I got my finger on this detonator, that's exactly what you'll do. And if I see a cop anywhere near here, or if you continue in that patronizing tone of voice, this whole place is going up!
He was a big help. Did you get Steve?
Yeah, he's on his way. Don't worry, we're gonna figure out a way to get Amanda out of there.
Maybe we should just rush him. Our combined weight alone would take him down. So I'm not a patient person.
I need some water.
Forget it.
She's scared.
Well, that's not my fault. That's Embry's.
She's also pregnant.
There's water in the fridge, and juice and sodas, and protein cookies. I'll just get it.
Just stay put. I'll get it. And sit down. You're making me nervous.
Come on, ladies. Okay. Easy.
I still think we should just take him.
Do you think Dr. Sloan can help us?
Honey, I don't know. Do any of you know what's wrong with this man, what he's talking about?
Of course not. He's crazy.
Besides that,
I have been teaching classes for Adam Embry for 5 years. He's a caring and ethical doctor who gives women and their husbands hope. Something a lot of them have lived without.
She's right. You know how long Craig and I tried to get pregnant?
I've always wanted to be a mother, to do right all the things my own mother did wrong. I didn't think I'd have that chance 2 years ago, but now Dr. Embry has given me 3 chances. Triplets.
Triplets?
Mm-hmm.
I want a sharpshooter at every window in this hallway. Yes, sir. You two, doctor's lounge.
Yes, sir. Steve, what are you doing? Bear said no police.
I can't ignore a hostage situation just because some nut with a bomb says I should.
I don't like having armed men in a hospital.
I know, but the clinic is directly across the street from here, which will give my men their best line of fire, if they need it.
But Amanda's in there.
I know. Hope it won't come to that.
They all have to go to the bathroom?
it happens when you drink water.
Well, then you can't have any more.
Mr. Bear, I understand your sense of urgency in getting your answers, but trust me, these ladies also have a sense of urgency.
No. No bathroom. They get out of my sight, they'll be gone.
How and where? Out that window?
Okay. But you're not pregnant. What's to stop you from leaving?
Because I am the only doctor here, and I'm certainly not going to leave them with the likes of you alone.
I don't like you.
I'm so surprised.
I'm the one with the detonator.
Look around you, Mr. Bear. There are overdue, hormonally ravaged, bathroom-dependent women here. Now, if you get in the way of their bodily functions, I know that they will tear you into tiny little pieces. Now who has the detonator?
Wish I knew more about what was going on in there.
Mark Sloan.
It's me,
Amanda?
Mark. I'm in the bathroom on my cell phone.
Amanda, if he catches you in there.
He won't. He's too afraid to come in here. He's finally learning what pregnant women are all about.
Look, just try to keep him calm. I'm on my way down to see Embry now.
Amanda?
Steve, what are you doing? Bear said no police.
I'm just trying to assess the situation.
The situation is I have 4 pregnant women and a lunatic with a bomb strapped to him.
What does it look like?
What do you mean, what does it look like? It looks like a bomb.
Amanda, it may come down to me knowing as much as possible about that device. The only person that can give me that information is you.
Hurry up in there!
Oh, we'll be right out.
Amanda?
I gotta go.
Thank you for seeing me, Dr. Embry.
Here at the Embry Clinic, we try to help nature become more beneficent. That's our only goal.
Offering hope to the hopeless.
Well, we have an outstanding success record. We use only the most advanced techniques.
It must be hard when those techniques fail.
Oh, very. But we counsel our potential parents never to give up. That hope you talked about. That's what makes families.
You didn't give Bob Bear one. You remember him? He's in your clinic across the street holding a group of pregnant women hostage. He says you used his sperm to fertilize one of them without his knowledge, and he wants to know who.
I knew something like this would happen.
That is true.
No! And it's all her fault.
Who?
Patricia Callender. She was my nurse and my significant other. I know it was unprofessional, and I finally broke it off. But when I did, she invented a bunch of wild stories about unethical practices at the clinic.
And one of those stories was about the unauthorized use of sperm.
And embryos and anything else she could think of. Fortunately, the medical board proved her to be a consummate liar.
Well, unfortunately, Mr. Bayer believed her. And right now, he's threatening to blow up that clinic unless he gets an answer.
Let me talk to Bob. I don't know that I can help, but I should at least try.
That's what Nurse Callender said.
Nurse Callender invented those lies to hurt me, Bob. I'm sorry if she hurt you instead.
No! You're the liar! I kept donating, and you kept storing just so you could give it away.
Now, we talked about that, Bob. We stored so that when Lorraine produced viable eggs, we'd have sperm of high motility that were ready to go.
Yeah, so motile that you couldn't keep them in the little jars.
I understand how difficult this has all been for you and Lorraine, but this is not the answer.
Doctor? Shut up. You don't know a thing! Sloan, are you still there?
Yes, Mr. Bayer, right here.
This bastard is a liar. You find Callender. She'll show you.
Mr. Bayer.
And if you don't find her, or if you call me back with something I don't want to hear, then these women are going to die. And it'll be your fault. You see? This guy, he would rather lie and watch you die than admit the truth.
No! Mr. Bayer, these women are not your enemies. And if you're right, they're just as much victims of Adam Embry as you are.
Ah!
What?
No,
Stop.
no.
My water just broke. She's in labor. And you're okay, so breathe through it. Pretend it isn't happening.
What's going on?
She's having a baby, you moron. With all the stress you've created, it's a wonder they all aren't in labor.
They wouldn't dare.
Miss Callender?
I'm not due back in pediatrics for 15 minutes. Go away.
I'm not from pediatrics.
Emergency, right? I don't do emergency. Blood mats my fur.
You used to be Adam Embry's nurse, right?
I used to be a lot of things. Now, I'm a rabbit.
Do you remember a patient by the name of Bob Baer?
Yeah, Mr. One Taco short of a combination plate. I'd rather spend time with puking kids. I do spend time with puking kids.
Right now, Bob Baer has 4 pregnant women held hostage across the street because he thinks that one of them is having his child. Only he wasn't involved, not directly.
And Adam says he doesn't know anything about it, that this is all my fault.
You have to help us prove otherwise.
Sorry, late. Gotta go. Lovely party, doctor.
Oh, you just told me you had 15 minutes.
You know, I really ought to get me one of them bunny batteries.
Look, Bob Baer is going to kill all of these women if he doesn't find out which one is having his child.
I told Adam that somebody would finally lose it if he kept playing God like that.
So then Baer was right. Embry has been doing unauthorized procedures.
Unauthorized fertility drugs, unauthorized embryo transfers, unauthorized sperm freezing, keyword unauthorized.
Why would he do all that?
Insurance payments,
So he did anything he could to keep charging until the benefits ran out.
which made him the biggest beneficiary of all. He's probably got a boatload of money stuck out in the Cayman Islands just waiting for him and Nurse Perky the beach bunny. And I bet she's wearing real fur.
Okay, and when you went to the hospital board?
Adam makes $1 gazillion for this place. By the time he was through with me, I'd lost my nursing license and gained a bunny suit.
What about the records?
He said I faked them. Like I could copy that hieroglyphic he calls a signature. Oh, God, I hate that man.
Okay, then look, then you gotta help us stop him. I mean, show us the files. We'll believe them.
And if you don't, I could get thrown out of this hospital for good. Entertaining kids with this stupid suit is all I have left. It's not my problem.
It is your problem if you're the only one who can save these women's lives.
What's taking so long?
You try having a baby and see.
Oh, my back hurts.
There's some towels in the bathroom and a water bottle under the sink. Did someone say bathroom?
Well?
Go on.
Please don't tell me you're having contractions.
With 3 babies sitting on my bladder, who could tell?
Dr. Sloan.
Hi, it's me. Juliet's gone into labor.
Can you see the head yet?
Yeah, but I haven't practiced obstetrics since I was a resident.
Well, Cheryl's a trained nurse practitioner. It ought to help.
Mark, these women are having multiple births. What if one of them should go into labor? And tell Steve this lunatic has dynamite wrapped all the way around his body, that the detonator looks like a call button out of a hospital room, and that it's attached to a silver box with a red light. I've got to go. Are you sure you're okay?
My blood sugar's through the floor.
All right, well, maybe you should have had one of Cheryl's cookies. It's just a thought.
That much explosive could take out the clinic and half the hospital.
I just hope Jesse's found Patricia Callender and that she's right and Embry is lying. Otherwise, I don't know what to tell Bear to get him to let those women go.
Lieutenant Sloan?
Mrs. Bear? Oh, thank you for coming down. This is my father, Dr. Mark Sloan. He's been talking with your husband.
Can I do anything to help?
Sit down, won't you, Mrs. Bear? You know, right at the moment, your husband is jeopardizing a lot of lives. If you could just talk to him.
I'm not sure he'll listen. Not anymore.
What happened, Mrs. Bear? What brought him to this?
Do you know what it's like to be a lab rat, Doctor?
I'm afraid not.
Stuck with needles, poked at, peered into, cut open, and all so that you can turn into some egg manufacturing robot and prove your husband's worth as a man?
Well, I know those fertility procedures can be difficult.
Bob went nuts trying to get me pregnant. And forget adoption. Oh, the only way he was willing to carry on Bear and Son's scrap metal tradition was with the fruit of his own loins. It's been a very bad year, Dr. Sloan. I don't blame him for wanting to kill Dr. Embry. Oh, I was ready to kill the both of them. But all those women in there...
Then will you talk to them?
Lorraine?
Bob, honey, this doesn't help.
I don't have a choice in this anymore. Embry took that away from us.
This isn't the way to fix it.
I'm doing this for Bear and Sons. You know that, hmm? One of these women is carrying the fruit of my loins.
The only fruit here is you.
You know how I feel about this.
Yes, oh yes. Only a kid with your DNA is genetically capable of hauling scrap metal, and for that, you threatened to blow up a bunch of pregnant women? You haven't got the sense of a dump truck.
Mrs. Bear.
You walked out on me, Lorraine. I'm gonna do whatever I have to get my kid.
But it won't be your baby. Even if it is your baby, you blithering idiot.
I'm through talking to you, Lorraine.
Fine. Oh, I told you it wouldn't work. He is totally unreasonable.
She never got it. Never. There has been a Bear and a son of Bear ever since there has been metal. You just don't give up on that.
What about a daughter of Bear? Or wouldn't that be good enough?
Well, maybe. That's changed a lot of signs.
Oh, I gotta push.
Push?
The baby's coming now.
Okay. Okay, hold on, honey. You almost said it.
All right, take it easy. Breathe. Breathe. It's okay. It's all right. Okay. Just breathe. All right. Okay.
Hold on.
Just breathe.
Hold on.
Okay.
Hold on.
Good. Okay.
Okay, Juliet. Okay, Juliet. Push.
Okay.
Push. Go ahead, push.
Okay, I can see the head.
Okay.
I can see the head. Push.
Great.
Okay. Good. Good girl.
Okay, now slow down.
Good.
Just let it
Good.
happen. Let it
Push
happen.
again.
Okay.
Push again.
You can't do it.
All right, easy. Yes, you can. I've got the head. I've got the head. Okay. Good. Good girl. I've got the head.
Okay, now breathe. Take your time.
time.
Breathe slowly. Come on. Come on.
Okay, there's one shoulder.
Oh, God.
Okay, turn, sugar, for me. Come on, baby. Turn that shoulder. Okay, good.
Slowly.
Okay, take your time. Take your time.
Okay.
Okay,
Push.
Come on,
We got it.
sweetie.
Come on,
Push.
push.
Finish it again.
Oh, my God. Okay, there's the other shoulder. There's the other shoulder. Oh, my God. You've got a girl.
That's great. Great. See, that wasn't so tough, was it? No. Okay. Yes. Oh, sweetie.
She didn't look anything like me. Didn't even look like her. Guess Embry got you too, huh? You someone else's sperm.
Oh, darling. My husband's Japanese-American, Craig Yahata.
Oh.
Mr. Bear, it's obvious that these two can't give you anything. Why don't you just let them go back to the hospital to make sure that they're all right? Please.
Okay, all right, but just them. I'm not done yet. Not till I get my kid. What are you doing?
I'm just calling the EMT to make sure that they send a gurney and attendant to meet her. That's all, okay?
Amanda? It wasn't low blood sugar.
Oh, my God.
What? What now?
Triplets.
Guys, this is Patricia Calendar, and these are what we've been looking for.
I'm hallucinating.
Embry's clinic records.
Yeah, look at that.
Oh, what do you know?
So you do believe me?
I told you they would. Well, they need me in the ER.
Yeah, we need both of us. Thank you. You may have helped save a lot of lives.
Well, Juliet, you're gonna be fine, and so is your baby.
You know, that crazy guy over there, he's just crazy, isn't he? I mean, about Dr. Embry. Amanda's gonna be all right?
When you did the in vitro procedure, I guess you had to sign a lot of papers.
I don't know which was worse, the hospital paperwork or the insurance forms. The insurance forms.
Were you ever asked to sign permission for use of unused embryo for research?
Yes, but we didn't want to risk giving any away.
So then this isn't your signature right here authorizing the donation?
Absolutely not.
Well, it's beginning to look like it's possible that Mr. Bear isn't so crazy after all. Any word on Embry?
No, he's left the hospital. He's not responding to his page. His car phone's turned off, and the officers I sent to his house say he hasn't showed up there yet.
We've got to find him. There's more going on at that Embry clinic than even Bob Bear knows about. Dr. Sloan.
It's Adam Embry, Dr. Sloan.
Embry?
I'm sorry, I've been ignoring your page.
I really have to talk to you.
I know. I'm on my way back to Community General right now. I've been thinking about this all day.
Bob Bear was right, wasn't he? You've been forging signatures and stealing embryos and sperm for use in other patients.
Families are built as much on love as on genetics, Doctor. I honestly thought I was helping people.
You have got to tell Bear the truth.
The truth is, it's going to be a while before we find out if any of those women are carrying his baby. But I will talk to him. But something's wrong.
What is it?
I can't stop. My brakes are out.
Embry? Embry! One thing for sure, we can't let Bear know that Embry's dead.
Why not? He might just give up.
No, it's more likely to push him even further over the edge. Bear thinks Embry's the only one who can tell him the truth. And if we're going to change his mind about that, we need time to look at those files.
Hey, this is the video surveillance tape from the hospital parking garage. Sweeps the area every 3 minutes.
Are you sure Embry's brake line was cut?
Well, the CHP checked the car when they pulled it out of the bay, said it seemed pretty obvious.
What about the body?
Well, the car was empty. They're going to check up and down the coast, but with those currents, they don't know if they'll ever find the body. Well, here comes Embry's car.
You gotta be kidding me. Do you really think I'd be stupid enough to wear this if I were gonna sabotage Adam's car?
You had plenty of reason to want him dead.
Yeah, you bet I did. He dumped me for that Nurse Perky and then made sure I'd spend the rest of my life in rabbit ears.
But those are yours.
Everybody at the hospital knows I keep a second suit in my locker. Kids puke at inopportune times.
I'll send an officer to check the spare for grease stains if it's all the same to you. I don't suppose you have an alibi.
Probably. Let me think about it. I told you I'd get thrown out of this hospital. I just didn't know it would be in handcuffs.
Dr. Travis to emergency. Dr. Travis, please report to emergency.
Mark Sloan.
Mark, triplets.
What?
Colleen Atkins is having triplets, and there's another woman who is in labor, and she's gonna have twins.
5 at once?
Mark, listen. I may not be up on my OBGYN procedures, but let me tell you right here and now, I know I don't have the equipment or the supplies to bring 5 babies into the world at once.
Jesse and I are double-checking the clinic's records, and it looks like Bear is right. But we need some time to come up with an answer that's going to make him happy.
Well, what do you know? The lunatic had a point after all. Can you get Embry to admit it?
Afraid not, Amanda. Emery's been murdered.
What? Well, that's just great. Bear's unstable enough as it is. When he finds out that Embry is dead, he's gonna lose his mind.
That's why you can't tell him. Amanda, Steve's got sharpshooters watching your front window. If we can't get Bear to surrender.
Wait a minute, you want me to walk him to the window so that you can fill him with lead, and I've got a room full of pregnant women? Are you both crazy?
Damn right, you're crazy!
Amanda! Embry's dead, is he? I knew that bastard would figure a way out of this.
By getting himself murdered?
He's clever. But you, I warned you about the cops, but I should have known that you wouldn't listen. You love to talk too much.
Okay, Dr. Sloan has found evidence that Dr. Embry has been doing exactly what you said he's been doing. If you'll just let me make...
No! No! I'm sick of this. Fed up with it. The cops want me out of here? I can do that.
No!
Hey, take it out in the hall. I'm having babies here.
You people make me so tired.
Those babies are on their way. And since you don't seem interested in letting us out of here, I'm gonna need help delivering them.
Why? You delivered the one before. It wasn't any big deal.
Well, it is. It's a very big deal. Those are 3 low birth weight babies. And if I don't get an EMT and decent equipment here quick, those babies could die. And I don't think you want that blood on your hands, no. Especially since 1, if not all 3, are yours.
Okay. 1 EMT.
Dr. Sloan?
Yes.
I was thinking I could talk to Bob again.
No. I appreciate your offer, thank you.
I heard a rumor that Embry is dead.
That's true.
That was nice of him.
He was murdered, Mrs. Bear. Someone cut his brake line before he left the hospital early this morning.
I could have done it.
Yes, you could have.
And I might have. Especially if Bob had killed all those people. But he didn't. So I didn't. Maybe I should have. Are all those women and are they going to be all right?
Well, they'll be all right if my son can get your husband to surrender. Otherwise, I'm afraid there are going to be a lot more deaths, including Bob's.
What do I do? Okay, I want you to time the contractions, breathe slowly, and relax. Okay?
Okay. I'll stay right here with you.
Hi. Laura's only 3 centimeters dilated. Oh, it's gonna be a while.
We keep having babies at this rate, and we can start our own basketball league.
All right, come on. Close the door.
Thank God the EMT's here.
No quick moves.
No problem.
Aren't you awfully tall for an EMT?
I'm just here to help.
Okay, just don't do anything.
Don't worry. Doctor, would you help me set up the incubator?
What are you doing here?
My job. Besides, you said you needed help.
I need medical help, and I still need medical help.
You need someone trained to handle a guy with a bomb.
So what are you gonna do? Throw yourself on him for the good of the group?
I really hope it doesn't come to that.
You'd rather walk him over to the window and have the cops fill the place with lead?
No, we haven't filled a place with lead in years. Besides, I don't think...
Come on. Okay, Cheryl, I can use your help. Mr. Miller, would you take the place, please? Come on, let's go.
You're an EMT?
Well, I haven't done this in a while.
Don't they do refresher courses?
I missed the last one.
Oh, wonderful. Well, just tell me to take slow, deep breaths and relax. Like this. What you said before about, that Bob was right about Dr. Emery, that was just to calm him down, wasn't it?
I'm afraid not. Dr. Sloan's discovered something, but he didn't have a chance to tell me more about it.
Just doesn't sound like Adam. I've known him for years. And he's dead. This is unbelievable.
Apparently, Dr. Embry was very good at hiding the truth.
Now, you're supposed to tell me to take one last slow breath.
Take one last slow
Not
breath.
now. Oh, man. If my husband doesn't change every diaper for the next 3 years, he's dead.
I believe it.
These look like transfer records of some sort, but they're all in code.
Lorelei 4 to Bambi 3, Vulcan 12 to Barbarella 7, and then there's a Doc Furt everywhere.
Oh, that's Embry's license plate number saw on the videotape.
You think he was using his own sperm?
That's what it sounds like, all right. You know, we really need Patricia Callender to translate this if we're going to give Bear any kind of an answer.
Look, I don't think she's going to be too eager to help us out after we accused her of tampering with Embry's brakes.
Well, look, find her anyway. You earned her trust once, Jess. Maybe you can do it again.
Take one last deep
Shut
breath.
up! Oh, can I cancel my contract on this baby thing now?
When's she gonna have him?
We have a problem here. At least one of those babies is breech. I need a real OBGYN.
No more people. No, I already got you the one EMT, not that he's doing anything.
I'm not asking you to let anyone else in. I need Dr. Sloan on the speakerphone. I'm sure he can talk us through this. Well?
It's a girl! Here, Cheryl. Put her in the incubator.
That's two.
Can I go home now?
You're doing really good, Colleen. We've just got one more to go.
You sure that cop's not going to try to arrest me?
I think he's a little busy right now. And hey, if you didn't trust me, then how come you decided to come back up here?
Morbid curiosity.
Okay, Mark, this third baby is definitely breech.
All right, you can try and turn the baby around, or you can deliver it this way.
Well, no, if I do that, then I risk getting the umbilical cord caught around the neck.
That could happen in either case.
Well, then I'll leave well enough alone.
Contraction! Do I push?
No, just let it happen naturally.
Oh, it's easy for you to say.
Breathe through it. Just breathe through it. You've done it twice.
Okay, the buttocks are free.
All right, now rotate the baby 180 degrees. The first arm should deliver.
It's done.
All right, now rotate the other way.
Okay, I've got it, but the head is still inside. Mark, the heartbeat of the baby is slowing down.
He's trying to breathe.
Amanda, reach in and cover the baby's nostrils with your fingers. Now, gently pull them out.
Breathe through it. Through it.
I got him. Thanks.
They all look like me.
It's not over yet.
Hi, these babies are alive.
Yes, they are alive. But it's not enough to just deliver them and put them in that incubator. They're small, and their lungs are fragile, and they need to be in a neonatal unit.
Oh, they're not going anywhere. Nobody's going anywhere with my babies. Just shut up and get back to work, would you? You've got another woman in labor, remember?
You shut up and take a look at this baby here. Look at all of these babies. You could be the father. How dare you jeopardize this baby's life? All of these babies' lives. This isn't about you anymore, Mr. Bear, or getting your answers, or Adam Embry. It's about giving these children a chance to live.
Embry's really dead?
Yes.
Well, nothing ever works out the way you plan it, does it? Just give me a second to turn this off.
Sloan here, it's over. Send in the EMTs.
Right away.
Mr. Bear.
Yeah, something's wrong. I can't quite turn this thing off.
And the bomb squad.
Copy that.
So I downloaded the plans off the internet. I mean, they seemed all right to me. You can't trust the internet. Who can you trust?
Right, I'll be outside. Good luck.
Fortunately, the bomb squad downloaded the same plans you did.
You know how to disarm the bomb?
Yeah.
Oh, well, if you're as good a bomb expert as you are an EMT. You know, I thought the plans...
You thought wrong.
Well, thank goodness that's over.
Sit down.
Oh, what a day. Jesse said babies and moms are doing fine. He's got 2 more in labor. You were terrific. Well, you both were.
You idiot.
I wasn't wrong.
No, you weren't wrong about Dr. Embry. But none of those women were carrying your baby.
I told you.
But what about all that sperm that I was giving?
Infertile. Dr. Embry kept you donating so he could keep billing your insurance company. Once the money ran out, he was planning to use his own sperm to fertilize Lorraine's eggs, which, incidentally, are fine.
Fine? They put me through all that and I'm fine?
What, you mean to say that none of these babies could possibly belong to me?
As a matter of fact, some of them were probably Dr. Embry's. The records show that he had done that. But none of the babies were yours.
Lorraine, I'm ready to reconsider adoption.
Let's go. Oh, Miss Calendar, I want to thank you for your help yesterday. We would never have figured out what Embry was up to if you hadn't decoded those files.
Yeah, too bad you weren't around 8 months ago when I took it to the board.
Well, I will be this time. They're reopening the investigation. However, you'll have to give up the bunny suit.
You know, I knew if I got involved with this
The
again,
commission is willing to restore your nursing license if Jesse and I testify on your behalf. Only if you want us to, though.
I have always hated rabbits.
The next time Amanda needs help with pregnant women, you are definitely the one to go.
A little cranky, were they?
Now try homicidal.
You only have a couple of broken bones in that hand.
Hey, guys. I've got Adam Embry's autopsy report.
I didn't know they found him.
Yeah, late last night while you were delivering babies.
He definitely drowned. Salt water in his lungs, contusions from being banged around after the airbag deflated.
Now, that's consistent with the car crash I heard.
No signs of drugs or alcohol in his system unless you consider carob, wheat germ, and apricots deadly. But I can't figure out what time he died.
See, the water in the bay is too cold to give me anything more than a 12-hour window.
Just swimming in that bay can be lethal. Imagine drowning in it.
Ah, that bay is getting cleaner all the time. I mean, I wouldn't eat the fish out of it, but it...
Wait a minute. Something's wrong here. Adam Embry didn't die in that car crash.
That's Adam, all right.
I'm sorry to ask you to identify him formally. We just had to have it for the records.
I understand. I just can't believe somebody killed him. Do you know who yet?
Yeah, it's not easy. You hurt a lot of people, like Lorraine Bear.
You think she did it?
Possible. We know she was in the hospital before Embry left. Then I saw her in the lobby later that night. Of course, you couldn't have known that. You were being held hostage at the time.
Right.
Then, of course, there's Patricia Calendar. I know I'd want him dead if I had to walk around on a furry bunny staying away. Then there's you.
Me?
You really believed in what he was doing, didn't you? Must have been a terrible shock when you found out the truth. But then you couldn't have done it. You were being held hostage when he was killed.
True. I really need to get back to the clinic. I've got another class.
There's just one thing. He was killed later.
I'm confused.
If someone cut Embry's brake line, why would they drag his body out of the car, drown him in a bathtub, and then throw his body back in the bay hours later?
Why do you think Adam was drowned in a bathtub?
Because if he drowned in the bay, the water in his lungs would have been full of pollutants, and they weren't.
Oh.
Embry staged that accident to make it look as if Patricia Calendar had cut his brake line.
Then, who did kill him?
The woman who was having an affair with. Nurse Perky, you. He needed a place to hide until he got out of the country. You were the only one he trusted, and he couldn't get to you until the hostage situation was over.
Okay, I was his lover. So what? That doesn't mean I killed him.
Well, a couple of other things showed up in the autopsy report. We examined his stomach contents. Wheat germ, carob, and dried apricots.
So he liked a healthy breakfast?
The same ingredients we found in the cookies you made and took to the childbirth clinic. He was waiting for you in your apartment, wasn't he? He was going to offer to take you out of the country with him.
I believed in him. You know? In the work he was doing. It was all a big lie. He hurt so many people, including me.
He was going to leave you there with the others to die.
He was so afraid of telling the truth, he nearly got me and all those babies killed. And when I confronted him, all he could do was tell me that my cookies tasted like tree bark.
And since he was already dead, what's the difference in killing him again?
Seemed like a good idea at the time.
Hey, Dad, did you hear? Colleen Atkins named her triplets after you, me, and Amanda. Kind of a thank you for our help.
Guess what, guys? Juliet named her daughter Amanda. Isn't that sweet?
Just two Amandas in one day. Colleen Atkinson named her Steve, Mark, and Amanda.
No kidding.
Hey, guys, are you ready? The other women from the hostage thing gave birth last night. A set of twins and another set of triplets.
I'm glad I wasn't there.
And forget this, out of the 5 kids, there are 2 Amandas and 2 Marks.
I've got more than you do.
What?
If Juliet had had twins, we'd be even.
One's better than none, I guess.
I'm a little lost here.
Considering you were such a big help, you're lucky you have any at all.
Hey, guys?
I helped. I coached. I did the breathing.
Awake the disoriented. Blood pressure's 90/50, pulse 124. No evidence of facial trauma, just abdomen and knee. Got a liter and a half in the rig.
Acute abdomen. Let's get him into surgery. Stat.
Look all over.
Jesse?
BP is 90/50, acute abdomen. We're gonna set up an OR1.
Sorry, son. You were in a car accident. You'll be fine.
All right, watch the zone.
Hey, he's okay. He lacerated his spleen, but we were able to take care of it through the scope.
Oh. You were in there so long.
Well, you know, his right knee didn't look too good, so I figured as long as we were in there, we should scope it. You know, I fixed it. He'll need to spend a few days in physical therapy, but otherwise, he's gonna be fine. I tell you, between the VIP nurse's treatment and the Demerol, he's gonna get himself a good night's sleep. I suggest you go home and do the same.
Yeah, I think it will. You staying?
Just one cup of coffee.
Okay. Yeah, well, I'll be going.
Oh, hey, by the way, those are great-looking shoes.
Yeah, I got another pair just like them at home.
Mycin?
You're giving all the samples away to indigent patients again.
That's why you gave them to me in the first place.
I thought I was supposed to be the salesman around here.
You know, you never did give me an answer.
About what?
When can we have lunch?
Tomorrow.
Hey, you're on.
Isn't that the drug rep from Zentex Pharmaceutical?
Yeah, Robin Hilton. She's kind of cute, huh?
Yeah.
Did you check in on Steve?
Yeah, he's still sleeping. Doing pretty well, though. Zentex is in the middle of some trials for a new cancer drug. Aren't they Lexamide?
Yep.
Didn't I hear that you invested a bunch in the stocks for Zentex?
A bunch? On layman's terms, yeah, you could say a bunch. But the actual technical term is truckload.
Well, Jesse, no offense, but isn't that just a little bit like insider trading?
Insider trading? No, that's not insider trading.
Let me get this straight. You take kind of cute Robin lunch, and you find out how the clinical trials are going on the new miracle drug. You determine how many truckloads of stock you're going to buy based on the information that Robin gives you. Now, isn't that just a little bit like insider trading?
Not at all. No, not at all. First of all, pharmaceutical stock analysts follow the trials and report through the media. All right, so anybody with any interest in these trials can hear about them on the evening news.
Well, that's right. Dan Rather talks about Lexamide every night.
Secondly, we won't know the final verdict on Lexamide until the FDA announces it publicly. Until then, everyone has an equal chance to buy Zentex stock now or later. I'm just betting that the trials are going to be successful.
Based on information you get from the drug rep.
Yeah, and Dr. Hart, who happens to be a very good friend of mine. And, you know, besides, I follow up on all the patient's progress myself. It's not insider trading. It's more like standing on the outside, peeking in through the door trading.
I need backup. There's been a murder. They were struggling over something, and then... Wait a minute, they knocked over a bottle of something. It was red or orange on that wall, right? They must have cleaned it off somehow.
Steve.
Look, The doctor had a knife. Look, I'm telling you, I saw them as clearly as I'm seeing you now.
You sure it wasn't a dream?
Look, the patient was in that bed. The doctor was fighting with him. It was no dream.
It must have been the Demerol.
What are you saying? I was hallucinating?
Well, that happens sometimes. Post-op medications can interact.
I had a patient who thought she saw a soccer game going on in her room.
It seems so real.
For what it's worth, Steve, nobody's been in this room since you were admitted last night.
You just take it easy and take care of yourself and get better. I brought you a shaving kit and that Robert Craze novel you were reading.
Thanks.
Important thing is to get you off to physical therapy right now. We gotta keep that knee flexible.
Knee?
Oh, yeah, you tore a meniscus. Jesse had to fix it.
You let him come near me with a knife?
Just be grateful I took that sports medicine seminar in Denver last year.
Grateful doesn't begin to express how I feel.
You know, I could have gone to an asthma conference in Bora Bora.
Yeah, but the skiing is not nearly as good there, huh?
You know, you help a guy out, you make sure that he's gonna walk again, and this is the thanks you get.
Steve Sloan?
Yes.
Hi. Robert Timmons. I'll be helping you with your rehab. We say we get started with a couple easy stretches.
Steve, I leave you in good hands.
I'm really sorry to tell you about your husband.
It happened rather suddenly. I mean, I stopped in to see him around 8, and his vital signs were normal. But then at the next shift,
I was on duty when he took a turn for the worse.
I see.
We gave him high doses of antibiotics. We couldn't turn it around.
Well, I guess I better... I just wasn't expecting...
is there someone that we can call for you, or...
No. Well, I guess I better make some arrangements or something. Oh, my coat. I left it in Edgar's room last night.
I'll get it for you.
Thank you. It's a red cashmere.
Mrs. Wellers, I know you and your husband were having a tough time. I just want to say that.
I know. He was so awful, wasn't he? You know, my Aunt Pongy always used to say, we all have a purpose in life, even if it is just to serve as a horrible example.
I'm sorry. I don't know about that. I'm
Oh, I didn't mean you. I'm sure you did everything you could. Well, I guess I better call some funeral homes.
Hey, Walter, how's it going?
Hey, just lost one of our trial subjects. Lex and my trials.
What? When?
Yeah, just a couple of hours ago. I was just talking to his wife.
Oh, man.
When he was 64, he had colon cancer. And the Lexamide was beginning to make a difference. I mean, his CEA was coming down.
Not soon enough, huh?
Well, it wasn't the tumor that got him. He was in septic shock.
You know the source of the infection?
No. But it looked like staph in the gram stain. I mean, his fever spiked in the middle of the night. By the time the resident caught it, it was too late.
Widow take it pretty hard?
I heard them fighting last night when I was on my rounds. I mean, you'd think, since he had died, that she might feel a little, bad.
She doesn't?
Who can figure people, huh? Well, when I make my report to the FDA, they'll probably want to start the protocol over for a new patient. And we've got a long waiting list, so it shouldn't take too long. If he wasn't taking the Lexamide, he probably would have succumbed to the cancer by now anyway, but still, you think you're going to give someone a few more years.
Tanya, would you send this to Dr. Sloan with one of my buck slips, please?
Thank you.
Tanya, let me see Steve Sloan's chart again.
Sure.
Thanks.
Okay, it doesn't say which aide brought him up from the emergency room.
I'm pretty sure it was Rocky.
I need to talk to him. Do you have any idea where he might be?
I'll check.
What are you doing?
Oh, hi. Probably nothing. What's all that?
Oh, I asked your captain if I could bring these over. These are your unsolved cases.
Were you worried I'm going to have a little too much extra time in my hands?
No, you know, I got to thinking. Now, maybe this thing you saw, the murder?
The hallucination?
Maybe in some way it's related to a case you were working on, and that's why it was so real to you.
You thought that if I took a look at some of my old cases, I'd realize which one was making me hallucinate.
Maybe.
Look, Dad, I appreciate what you're doing, but I didn't make this up. A man was killed in this room. You knocked something over when we were fighting. There was a stain on that wall.
How about a John Doe strangled in Griffith Park? Two gang members in a knife fight.
Yep.
Well, according to the witnesses, they had their baseball caps on backwards. Now, a baseball cap on backwards could look like a scrub cap.
Steve? Steve? What's the matter?
The TV's wrong.
What TV?
The TV in the room where the murder took place was on the left side of the door. This one's on the right.
Listen, you're supposed to be resting. You're gonna get better if you don't rest.
There it is. That's it.
I spoke to the aide who brought you down from recovery, and he said that he placed you in this room for a couple of hours until your room was ready.
And that's when I saw the murder.
All right, just for the sake of argument, let's say there was a murder.
No, Mark, I did the autopsy on Edgar Wellers, and he died of an overwhelming staph sepsis, a very resistant strain.
No knife wounds.
No knife wounds.
Still, it's very strange. You know, Steve thinks he sees a murder, and in fact, a patient dies in that very room. And what about the betadine all over the wall?
Hey, I spoke to Dr. Hart.
What do you say?
Well, apparently Wellers was in the middle of a pretty ugly divorce. She wanted him to break off the prenups, but he refused. And if they had gotten divorced, well, she would have walked away with a very small settlement.
And now that he's dead...
Yeah, she gets everything. You know, Hart also said that during his rounds last night, he heard the two of them fighting in Edgar's room.
I suppose if he did get physical, one of them could have knocked that bottle of betadine against the wall.
Guys, Wellers died of a staph infection.
What time is my physical diagnosis class this afternoon?
4.
Gives me plenty of time.
Plenty of time for what?
Oh, you wouldn't happen to have Mrs. Weller's address, would you? There is no harm in covering all the bases.
Hi, musicians?
Beg pardon?
Are you the musicians?
Oh, no, I'm Dr. Mark Sloan from Community General Hospital. May I talk to you for a moment?
About what?
Won't take long.
Sure, come on in.
I'm very sorry about your loss.
Yeah, well, you know, trying not to dwell on it. Can I fix you a drink?
No, thank you. This is a little bit awkward. You were in the hospital, I believe, the night your husband died.
Yes.
Did you by any chance have a fight that night?
My husband and I fought every day we were married. Why would the last day be any different?
Oh. Do you think you threw anything at each other?
Throw anything? No, we argued, but...
Well, do you think you could have thrown or knocked over a bottle of betadine that might have splashed on the wall?
No, he was laying in bed. We yelled at each other, I left, and I came back in the morning and he was gone. What is this all about?
Well, some questions have come up about Edgar's death. You know, it probably doesn't mean anything, but would you allow us to perform a second autopsy, just to be sure?
Sure. You want him? He's all yours.
Oh, well, you had him,
Cremated? Yeah, this morning. Well, I'm expecting some people in a few minutes, for the wake.
Yes.
You're welcome to stay if you'd like.
Oh, thank you, but no.
Gracias.
What took you so long?
Don't be so sure of yourself. Could have been somebody else wheeling themselves into your room.
I don't know anybody else that's obsessing over a murder that never took place.
Keep thinking about that knife.
Me too. No knife wounds. Take a look for yourself. I've gone over the toxicology screen again. Antibiotics, pain medication, a sedative, the Lexamide. The only thing out of the ordinary is the fact that the staph infection traveled so quickly.
There is some bruising.
Perfectly normal. Patients who are very ill do bruise around their injection sites.
What about this?
What?
Right there, is that something?
Well, that could be a tear. Sometimes when a patient moves too suddenly during an injection, the skin does tear due to the needle. It's not that uncommon.
A syringe.
That's what I said.
He was stabbed with a syringe. But you said the infection spread quickly, right?
Well, yes, it had to have been a very virulent strain, one resistant to antibiotic treatment.
Could it have been injected? Look, here's what I think happened. The guy I saw in Weller's room injected him with a sedative that knocked him out, and then a highly concentrated dose of staph infection to kill him.
So now you're saying we have doctors roaming the halls killing people?
I'm not saying that.
What are you saying?
You have various strains of staph in your infectious disease lab right here. Who would have had access to them?
Can I see the sign-in sheet from last night, please?
Sure thing.
Thank you.
That doesn't look like a hospital issue.
A. Wellers, 9:15 p.m.
His wife?
I really find it hard to believe that any of our technicians would sign some stranger into the lab without seeing identification.
It wasn't even a signature, really. It was printed. Anybody could have printed her name.
There's still the matter of the red threads, too.
Now, both Dr. Hart and Dr. Walker confirmed that Ashley was wearing a red cashmere coat the night of the murder.
Yeah, I like her for this, guy. She seems to be perfect for it. But without a signature or a definite match on the coat, we don't have enough for an arrest.
Sushi, anyone?
Where'd you disappear to?
Oh, I was out doing a little bit of research.
Where? The two guys from Osaka?
There and a few other places. Gentleman's Request, June 1990. The Nurses of Gentleman's Request. Take a look.
Thanks, but I still have my novel to finish.
I think you're going to take a look at the centerfold.
And it's so unlike you.
Whoa, Ashley Nelson, registered nurse, Community General Hospital?
Nelson was a nurse at this hospital?
You think you'd remember someone like her?
Well, if she was dressed like that, maybe I would.
Okay, so this must have been before she married Edgar Wellers.
Yeah, she was on private duty after his first heart attack.
Well, with a body like that, I'm surprised she didn't give him another one.
How'd you find out about this?
I went to see Dr. Hart. He seemed to know a lot about his patient's personal history. So I asked him, how did Edgar meet his wife? The rest is literary history. Here's her nursing profile, right here.
So she would know about hospital protocol and infectious diseases, too.
And how to administer a lethal injection to a troublesome husband. She'd also have a community general ID.
Expired.
That could be fixed.
Mrs. Wellers has a lot of questions to answer.
This is ridiculous. Just because I didn't like him doesn't mean I killed him.
Mrs. Wellers, what were you doing in the infectious diseases lab?
I wasn't there.
We'll know the answer to that if there's a match on the threads of your coat.
If this is some kind of an attempt to blame Edgar's death on me, I'll sue Community General right out of existence. Edgar died under your care, not mine.
Mrs. Wellers.
If you have anything else to say to me, tell it to my attorney.
Thank you.
Well, it wasn't exactly a confession.
If the threads match, we don't need one.
3 ladies.
Hair tense. It's about how my luck's been going, all right?
Full house.
Deal me out. I'm done.
Sorry to see that surgery didn't hurt your poker game any.
You operated on my knee, Jesse, not my brain.
Yeah, my mistake. You win?
You know, it's just that whoever killed Edgar Wellers was wearing full scrubs, a mask, and a cap.
Steve, first of all, no one even believed there was a murder. Then you proved that there was. You even figured out who the murderer was. So relax. You can stop working the case.
Yeah, I'm just not sure Ashley Wellers killed her husband.
You were sure yesterday.
No, you were sure. I just didn't know how to dispute the evidence.
Well, it is pretty hard evidence to dispute. I mean, she's a nurse. We have threads of her coat tying her into the infectious disease lab. She hated her husband. Now that he's dead, she gets everything instead of nothing if they'd gotten a divorce.
It just seems like someone would have noticed if a woman that looked like her was wandering around a lab wearing a bright red coat.
2 cards.
How many?
I need to talk to her.
Well, the last thing she said to us was if we had anything else to ask her, we could contact her attorney.
Well, you're just going to have to convince her to come see me.
Me? I don't think so.
Well, I'll just have to go out there myself.
You're not going anywhere until that knee's better.
Well, you're just going to have to talk to her again, then.
Steve, you know, I'm beginning to think you are suffering from a mild concussion. You're seeing double and hearing nothing.
All right. I'll talk to my dad. He'll go out.
I'm sure he will. How many?
None.
Give me none.
King High straight.
Oh,
Hi. Wonder if I might speak with you for just a moment.
Hey, Sloan. Getting in some extra reps, huh?
Yeah, anything to help me get back on my feet.
Well, just don't overdo it. It'll weaken your immune system and leave yourself open to all kinds of things. Oh, hey. When you see Dr. Travis, tell him I took his advice. Got some of that Zentex stock. Yeah. Down $6.
I'll tell him.
So we missed our projected second quarterly earnings by 1%. The talking heads advise our clients to sell, and we dropped 6 points in 1 hour. It's ridiculous.
You sure it was the quarterly reports?
Yeah, what else could it have been?
Anything wrong with the Lexamide trials?
Jesse, how long have you known me? If there was a problem with the trials, don't you think that I'd tell you?
You would tell me.
Listen, Zentex is doing great. When Lexamide comes out, these stupid talking head stock analysts will be looking for a new line of work.
Yeah. Do you look in the menu? Know what you want?
Yeah. Why? Have you heard something?
About what?
The Lexamide trials?
No. What would I hear?
Well, you're at the hospital. You hear a lot of things.
No. I mean, except for Edgar Weller's death.
From Lexamide?
No, of course not.
There are causes?
Yes.
So no problem?
No problem.
Okay.
Okay.
You do know about the trials at Keller Memorial Hospital, don't you?
Walker. Oh, Dr. Travis.
Was just looking for Dr. Hart. Guess he left already.
You know what time he'll be back?
Not really. Looks like he has a new patient for the Lexamide protocol. It's good news, huh?
Yeah, that's good. I'll catch up with him later.
Hi, Detective Steve Sloan?
Yes.
I'm Ashley Wellers. I understand you wanted to talk to me? Yeah, well, after I slammed the door in your dad's face for the 3rd time, he went out to the beach side of my house and started serenading me. He made me laugh.
He's good at that.
Well, he said that you needed to talk to me and that if I was innocent, you could be the best friend I could have. So I'm here.
There's some things about your husband's death that don't quite add up to me. I don't think you killed him, but the evidence against you is pretty strong.
I didn't do it.
Can you explain how a thread from your coat got into the infectious diseases lab?
If there are threads from my coat.
Yeah, my partner Cheryl called this morning. They match.
I left my coat in Edgar's room that night. I suppose anyone could have gone in and pulled threads.
Can you tell me what you and your husband argued about the night of his murder?
Yeah, he wanted to leave the Lexamide trials.
Why?
He said he was getting all these side effects, dizziness, nausea, itching. I said, who cares as long as it stops the tumor? But he was determined to leave.
You positive about that?
Yeah, he had me bring up all the forms. He said he was going to go to the press, to Mike Wallace, tell the world that Lexamide was a fraud. I tore up all the forms and threw them in his face. I mean, I didn't like him, but I didn't want him to die. I thought Lexamide was helping. Ask Dr. Hart, he'll tell you.
Well, to be perfectly honest, I was hoping it didn't have to come out. I did report the side effects, and I thought, and I still think that my responsibility ended there.
The patient who wanted to leave the protocol is murdered, and you hope that no one has to discover that.
I don't believe that he was murdered.
I don't believe you cared one way or the other.
Look, I was angry that Wellers wanted to leave. I get furious when people enter clinical trials, take advantage of the best medical care there is, and then drop out before the trials are completed.
Furious enough to stop them?
You are way out of line, pal.
You know, Steve, I can understand why you would think that he's involved with this murder.
Did you know Edgar Wellers wanted to leave the Lexamide trials?
No.
What other secrets has he kept from us?
Look, I believe in Walter Hart. I've read his research papers. His work on colon cancer is extraordinary.
Have there been any other problems with the Lexamide protocol?
Not a community general.
Has this research been carried out at any other hospitals?
Yeah, Keller Memorial. It had to be stopped.
Why?
Because the population did not reach statistical significance. It means that too many participants either dropped out or died of other causes.
What other causes?
Heart failure, pneumonia. These aren't healthy people taking Lexamide.
Can you get me a list of the causes of death?
You're going after the wrong guy.
Jess, will you get me a list?
Yes, I can. You're just going to prove that Hart is innocent.
Dr. Hart, are you busy?
Hey, what are you doing here so late?
I needed to talk to you about the Keller Memorial trial.
Okay, what about it?
Were there any deaths due to staph infection at Keller?
I don't recall.
I was over there this afternoon. Someone's asking questions. If there's a problem...
There is no problem.
You're sure? Because if anything else were to delay the rollout of Lexamide...
It won't.
I'm glad to hear that. Good night, Doctor.
Good night.
Late, Doc?
the night nurse checked in on him about 30 minutes ago. He had a fever of 103. His BP was back to 90/50, and he had a pulse of 120.
And everything was all right when he went to sleep?
You can check the chart yourself. This has got to be the same strain.
Staph?
Yeah, resistant to antibiotic treatment. I gave him maximum doses of broad-spectrum antibiotics. I even gave him a dose of vancomycin. Nothing.
Maybe we should put him on the Zolvadex.
That hasn't been approved yet.
We can't let this infection get the jump on us. That's what happened to Edgar Wellers.
It could be toxic.
I know the risk, Jesse.
So knock his kidneys out.
And if we don't act, he could die.
I'll take care of it.
Hey, how's he doing?
Well, he held his own during the night, but still no improvement.
And Mark?
He's in there with him. I think they're both sleeping.
Jesse, if there's an outbreak of staph infection in this hospital...
There isn't.
What about Steve?
I know. Steve Sloan, Edgar Wellers, Doris Shumway.
Doris Shumway.
She was a patient at Keller Memorial. Steve asked me to find out the causes of death at the Keller Memorial trials. The last patient to die during those trials, the one who caused the studies to come to a complete halt, died of a sudden virulent staph infection.
Does Steve know?
Not yet. And I bet he was given the staph to keep from finding out.
I don't understand why anyone would want to kill Edgar Wellers just because he was dropping out. None of the other patients died during the trials.
It's just too much of a coincidence to be random.
We have to figure out what the motive is. Why did Dr. Hart kill Wellers?
You know, I bet that the answer lies in those research notes.
Oh, he'll never turn those notes over to us. Besides, it's far too much data for us to go over. But I could pull up Doris Shumway's autopsy report.
Jesse, can I talk to you?
Hi, good morning, Jesse. Something wrong?
I've just been up most of the night trying to save the life of my best friend, Steve Sloan.
Oh, the detective.
You know, what I'm trying to figure out is why would a man whose research is going so well risk everything to stop one patient from leaving the protocol?
You want to just tell me what you're saying?
We know that the Lexamide is working. It's killing the cancer cells. It's prolonging life. There'd be no need for a patient to stop taking it unless it was doing more harm than good.
My research is all well documented. You can look it up if you like.
The published documentation is only what you've parceled out.
Meaning what?
What else is in the research records that you haven't disclosed?
Is this a discussion about medical research, Doctor?
This is a discussion about the life of my friend.
Or is this a discussion about your portfolio?
Hey, look, my investments have nothing to do with this.
Are you sure? Because it sounds to me like you're trying to find a fall guy for your investment mistakes, and I will not be made your villain, Jesse. Now, if you'll excuse me, I've got a patient to admit.
But then I had an interesting conversation with Robin Helton. She told me she saw you at Keller Memorial last night trying to get rid of Doris Shumway's records.
Yes, I went to Keller to review Doris Shumway's records. They had been removed.
Fortunately, she wasn't cremated like Edgar Wellers. My colleague, Dr. Bentley, is going over to the DA's office today to request an exhume order. I'm pretty sure that a new autopsy is going to prove that the Lexamide was killing her before you finish the job.
You are so wrong about this.
I hope you're right.
You're going to kill the most effective cancer drug we've seen because of these fantasies.
Walter, no drug is worth killing patients over. Steve is coding.
I'll come with you.
You're not going near him. How long has he been in VFib?
About 1 minute. Charge the paddle to 200.
Charging.
Clear. 300.
Come on, Steve.
300 charging.
Clear. 360.
360 charging. Ready.
Clear.
He's back. Normal sinus rhythm.
Oh, thank God.
heart is guilty, he's convinced himself he isn't.
I keep praying he isn't.
Well, it's the only thing that makes sense. You know, when you followed him to Keller Memorial, you picked him up in the parking lot, right?
No, I was waiting down the hall from his office.
So you saw him leave his office and go to his car?
Yes. Why?
I was thinking that he must have gone downstairs to inject Steve with the toxin first.
Well, couldn't he have done that when he got back?
He must have, but it makes the time pretty short. You sure you got to Shumway's files before he can get a hold of them?
Yeah, and there were no notes in her files to indicate any side effects from the Lexamide.
And nothing to indicate that she was thinking about leaving the trials?
No.
And no way to prove that the staph infection that she died from was in any way out of the ordinary?
Mm-mm.
Wow, if he is killing his patients, he is doing a hell of a job covering it up.
Yeah. We'll find what we need in the second autopsy. How's Steve doing?
Better. I thought until the fibrillation, touch and go.
Anything I can do?
Well, I will, I'll call you when I get a hold of Shumway's autopsy. Hey, you're exhausted.
No, I'm fine.
Why don't you, go home? I'll stay here with them.
You haven't had any more sleep than I have.
I tell you what, I'll flip you for it. Heads I stay, tails you leave.
Okay. All right, I'll go down to my office and I'll take a nap on the couch. I'll be back in 4 hours. Okay.
Should make it 6.
Oh, hey, Dr. Sloan.
Yes.
How's your son doing?
Well, he seems to be doing better.
Ah, that's great. Tell him we're all pulling for him.
Thanks, I will.
Good. Oh, and tell him to forget what I said about Zentex.
About what?
I was ragging on him about the Zentex stock going down after I took Dr. Travis's advice and bought some.
Oh. Who else has been taking Dr. Travis' advice?
Who hasn't been? Kind of feels like it's our drug, you know? Lexamide, trials being here and all. Dr. Walker, he's placing buy orders almost every day.
Walker on an intern salary?
Seems like everybody's into the stock market these days.
Yeah. Thank you, Robert.
Sure. Whatever.
Mark, I've been looking all over for you. I'm afraid I have some bad news on the Shumway autopsy.
You know, I was just up at the credit union. We've been looking in the wrong direction. What's your bad news?
You go first. How did you get them to reveal Walker's credit report?
I didn't. I said, just tell me if I'm wrong. She didn't say anything.
Well, even if Walker did empty out his savings account, that doesn't mean he invested it in Zentex.
No, but if he did, he'd be desperate to be sure that drug got approved. He'd have as much writing on as Dr. Hart does. Listen, would you ask security to meet me up in Steve's room? I think I should talk to them.
Sure.
All right. Oh, what was your bad news?
Oh, I heard from my friend who works at the DA's office. I'm afraid we're not going to get that order to exhume Shumway's body.
Walker.
Come on. You all right?
Can I ask you a question, Dad?
What?
Is this another dream?
Why do you ask that?
Because
beginning to hurt.
I'll just be glad to get home, get out on the beach, do some surfing.
Now, you don't want to start overdoing it too soon.
Oh, Dad, believe me, getting out in the sand and surf, getting some exercise is exactly what I need.
I'll meet you at 4 o'clock, same place.
You got it. I'll be there. Bye. Steve, you checking out already?
Yeah. I'm so proud of this knee, I think I'll go jogging with you and Robin this afternoon.
Yeah, I don't think so. See, 2 is company, 3 is
Too many?
too many.
Anyway, Cheryl called. They're arraigning Vincent Walker next week.
You know what I can understand? Why didn't he just dump that Zentex stock when the market dropped?
He couldn't. He was out on margin. The guy invested every cent he had in it. So when the stock went down and his broker started calling him, asking him to pay off the margins, well, he panicked.
Well, I can see not wanting to face financial failure, but murder?
Look, if Edgar Weller said anything bad about Lexamite to the press, Walker's house of cards would have come crashing down.
I know why he went after Steve. He was afraid Steve was on to him. But why did he go after you?
Because I had seen him snooping around Hart's office. It was just a matter of time before we'd put it all together.
Oh.
All right. I see somebody I owe a pretty big apology to. Excuse me.
Dr. Travis. Well, I appreciate you.
Steve, this came for you.
Oh, who's it from?
I didn't open the card.
Detective Sloan, thank you for believing in me. Thank you for believing in yourself. If you need a private duty nurse, I'm always on call. Ashley Weller.
Save me the chocolate.
You know, you should think about getting a private duty nurse.
Dad.
She seemed like a lovely person on the inside.
Well, I'm sure she is, but I'm fine, thanks.
Well, you know, just so you're completely on your feet again.
Pistachios?
Tonight, Dave's sorting out the election with Cokie Roberts. Plus, the top 10 ways the U.S. would be different without a president. And know your current events. Tonight, first your local news.
They finished?
A few more days, week at the most, they'll have the floor dug out and they'll be able to start shoring up and resurfacing.
I'm not gonna last that long.
You know, maybe you ought to work a different shift for a few weeks.
Dan, it doesn't work that way.
Well, can't you tell the criminals what time to do their crimes?
No, I think the only solution is for me to move.
Well, you know, I could probably get you a good deal on a hotel.
No, actually, I've been meaning to talk to you. I was thinking that, you know, maybe it's time for me to buy my own place.
Yeah. Well, I guess a house is a good investment.
Yeah. That, and plus it'd be closer to work.
Yeah. Of course, there's also the tax write-off. You know, the thing is, it's always so quiet and peaceful here at the beach.
What?
I said it's so peaceful and quiet here at the beach.
Good morning, Lana. It's 6:55. The exterior temperature is 64 degrees Fahrenheit and rising.
Is the pool ready?
The pool water is stable at 82 degrees Fahrenheit.
Open the pool cover then.
Lana, you have a visitor.
Hey! Yup?
Come around back, Jesse. Let him in.
Security system disengaged.
Wow. This place is something.
Thanks. Hi. My dad said he built it just so that I move back home.
I guess it worked, huh?
Guess it did.
Hey, is there a place I could put these on?
Yeah, the bathroom's just off the kitchen. I left some OJ on the counter.
Hey, thanks.
not use the pool.
Lana?
Warning, do not use the pool.
Lana? Lana? Lana?
It is now safe to enter the pool. It is now safe to enter.
Diagnosis Murder. Sponsored by Glaxo Wellcome, makers of Relenza.
How could she have been electrocuted?
Well, probably a short in one of the underwater lights. We won't know for certain until we can drain the pool and our technician can do a full examination. How old did you know this girl?
Lana? We were friends, kinda.
What kind of?
Well, she moved back to L.A. after college, and her mom gave her my phone number.
So did her mother want her to be a doctor or marry a doctor?
I don't know, a little bit of both, I guess. Her mom is a surgeon. She used to work at Community General.
And this is Lana's father's house?
Yeah, she was living here. It's sort of a temporary, permanent thing. Kind of like you and...
Kind of like me and my dad.
No, because that's like entirely different. No, she just moved in.
And I've been living with my father forever.
You guys have a great house on the beach, and you get along so well.
I'm moving out.
Really?
Yeah, I've already got a realtor looking. Jess, don't mess with that, will you, till we're finished?
It wasn't me, it's the computer.
The computer closed the blinds?
The entire house is wired. A state-of-the-art computer runs everything. The blinds are set to adjust and close every time the sunlight hits it at a different angle.
Well, you can do that?
This house can do anything. It even warned Lana not to jump in the pool.
And she did anyway?
I don't know, I was here in the kitchen.
You wouldn't happen to know the name of the company that installed the system, would you?
Guess we could find out.
May I see some identification, please?
Lieutenant Steve Sloan.
Thank you, Lieutenant. Lieutenant?
Your system opened the door, Mr. Locatelli?
Bruce, please. Yes, it did. It also sensed your presence and turned on the lights. Would you come to my office?
Your sound system on sensors, too?
And he shall have music wherever he goes. If you don't like the selection, my CD library is at your command. Or actually, my command. It only responds to voices it recognizes.
Is this the same system you installed at John Kravitz's house?
Terrible tragedy, that. Mute the music, please.
What's that?
A video capture, a hell of a lot better than a printout.
Who decides where the cameras go?
Well, you pay, I put.
What's to keep you from spying on your customers?
The entire system is double password protected, so when you contacted Mr. Kravitz, he dialed in, entered his secret password, which allowed me to use my password to open the system and show you, well, this. Hal, if you would.
You named your computer Hal?
Yes, after the movie. It was kind of a joke.
Didn't Hal kill people?
Well, it seemed like a good joke at the time. Of course, I named him before I saw this. I think that's enough.
Do not use the pool.
Can you give me a copy of that?
Well, had it made as we spoke. Now, you'll find that my system not only sensed the short, but closed down to the power to the pool as well.
What you're saying is, if that young woman had been any place else but in the water at the time of the short, this never would have happened.
The Locatelli home command and control system is not just another means for you never to touch another doorknob, Lieutenant. It's the most powerful home security and safety system on the market.
Well, I mean, the
first time I heard of you, I was in high school, a mere child, really. You were in the newspaper. I said to myself, that is what I want to be.
A medical examiner.
You? Oh, I wanted to be you.
Oh, how nice.
And here I am, a third-year medical student, and not only talking with my idol, but actually working with her. Oh, I hope you don't mind my saying all of this.
Oh, not at all. Carry on.
If I could just be the next Dr. Amanda Bentley.
Well, where would that leave me?
Retired?
Oh, lovely.
Oh, I didn't mean that the way it sounded. You know, I meant years from now, after you've taught me everything you know.
Excuse me, Dr. Bentley. We have a 51-year-old woman, no previous illness, who died 2 hours after admission.
Symptoms?
High fever, chills, rash, headache.
Who's the physician?
Dr. Horowitz.
Let's take a look.
I'm telling you, Dad, I've seen the future and it works.
Dr. Sloan, I presume.
Yes, how do you do?
Will you be sharing the house with your son?
Well, actually, we already share a wonderful house.
Because there's a 3-bedroom model I can show you.
Oh, no, this will be fine, thanks.
Open says me. In 5 years, every new house will come with these features.
Always wanted to be on the cutting edge.
It took some looking, but this place has got everything you asked for and more. The study's been converted to a safety bunker. It's fireproof, earthquake-proof, and riot-proof.
Isn't that a bit of overkill?
The owner didn't think so, sir. He had a friend killed in the riots a few years ago. These air vents. When the room is shut down, fresh air is pumped in.
Sure thought of everything, didn't he?
Oh, and notice that every room is both DSL and cable modem ready.
DSL? Oh, the internet.
Who can live without it these days?
Well, it's not a big part of my life, I have to admit. I'm somewhat of a troglodyte in that area. You know, especially after what happened to Lana Kravitz.
Dad, look, the computer didn't kill her.
Yeah. Did you know her mother worked at Community General, Dr. Janet Kravitz?
Yeah, Jesse mentioned it. Do you know her well?
No, not really, but I did talk to her at the funeral. You know, it's interesting. She was contacted to see if she wanted one of these systems in her house in Boston.
Oh? How'd she like it?
She didn't. She turned them down. Said it reminded her too much of her ex-husband.
Look, Dad, I like this house a lot.
Good. I mean, you're the one's going to live here.
The owner is in the middle of divorce hell. He's willing to do a quit claim if you want to move in right away.
No kidding. Hey, I wanted to ask you about that jacuzzi out there. Is that, what exactly is it?
Ellie, thank you for doing this for me.
Oh, it's my pleasure. I love the internet. It's how I keep up with my parents, my grandparents, my boyfriend. In fact, these days, it's practically the only way I talk at all.
You know, I didn't even know the hospital had a website.
Everything has a website. Well, I can even set up a personal one for you.
No, thank you.
Would you like to see how many times Dr. Bentley's name is mentioned in the newspaper?
Can you do that?
I can find anything.
What if I wanted to find a computer system for my home? Could you find that?
Name it.
Home command and control systems designed by a man named Bruce Locatelli, I think.
First, we go to a search engine.
EWB. Yeah, I got your message, but I'm still puzzled. We already passed our code inspection.
Oh, it's a new service that we provide. Routine inspection before a new customer moves in.
Yeah, but how'd you know this house sold?
Multiple listings.
Well, we go ahead, doors open. I got to deliver some good news.
Well, thank you.
Oh, that's great. Closing tomorrow at Valley Brook Federal, 2 o'clock. Right, thanks.
Hal, are you there?
This isn't our system, Bruce.
I know. But I can take it over. And no one will ever know that we were here.
You know, it's amazing what you can find on the web. They had cancer research that hasn't even been published yet. And then I looked up old Fred Astaire movies. They had a nearly complete list of all the credits.
What do you think?
Donated. Then I found something else remarkable.
Did I actually ever wear this?
Yeah, you did. I found home command and control systems.
Dad, that death was an accident. I mean, I had long conversations with the father, the mother. I checked with the friends. Nobody suspects foul play.
That's exactly what Sybil Thorsten said.
Okay, Dad, I'll bite. Who is Sybil Thorsten?
Denise Thorsten's mother, up in Hartford, Connecticut.
And the connection between Denise Thorsten and Lana Kravitz is what exactly?
They both died in pool accidents, and both houses had Bruce Locatelli's system in there.
Dad, computers do not kill people.
Well, doesn't that strike you just a little bit suspicious?
Well, was there any other connection between these deaths whatsoever?
None I know of, no.
Well, then, no, I don't. And I don't worry about my house having a system either, Dad. I mean, this Bruce character didn't even make mine.
Well, this isn't about your new house.
No, of course not.
You know, maybe it'd be a good idea just to shut it off until we look into this a little further.
Dad, I like my new house. You know, the computer system's one of the reasons I bought it. And the police investigation was very thorough.
You think I'm being foolish, huh?
No, not at all.
Couldn't talk you out of those either.
Heck, no, these are keepers.
Do you ever get used to this, all this automated stuff?
Honestly, I've gotten to the point where it annoys me to have to use a light switch.
Excuse me, Mr. Locatelli, I'm finished, unless you need...
Oh, no, Maria. Hasta mañana.
Hasta mañana.
Gracias por todo.
That's cleaning lady?
My house manager. Couldn't live without her.
Does the computer respond to her voice as well as yours?
Yes, I programmed the system with a full Spanish vocabulary. Please, sit down.
You can restrict access anytime you want?
No, I can do anything.
You can, not your computer.
The computer's only as good as the programmer.
You know, that's almost the same thing my son said when I presented him with a very curious coincidence. I was checking out your system on the internet.
Denise Thorsten.
You knew about that?
You think the police didn't investigate that death, too?
Would you mind explaining what happened there?
Well, it seems she ordered the pool cover to close while she was still in the water.
Why would you do that?
She was drunk.
And you're positive it was Denise that gave that command?
That's what the computer records show.
Is it possible for anyone else to issue a command to this system? You, for example, you got into the Kravitz system.
All my systems are double password protected, so no, not without the owner's permission.
I don't know that much about computers, but Jesse told me those systems have a, what'd you call it?
Backdoor.
So the manufacturers can correct errors in the program.
So you do have a means for getting around the double password system, don't you, Mr. Locatelli?
You know, I really hate to do this.
Do what?
What I'm about to say, to backdoor into a system requires a high level of sophistication, not to mention a prior knowledge of the program's proprietary codes.
And you meet both criteria.
And so does my competition.
Any particular competition?
Donald Purdy. My system's beating the pants off his.
Are you suggesting that Purdy deliberately killed Denise Thorson just to make your system look unsafe?
And that is exactly the kind of accusation I didn't want to make.
That jerk. I bet he led you right to me, huh?
As a matter of fact, he did.
You know why? Because I'm gonna put Bruce the Goose out of business.
Sounds like you two have quite a beef going.
He stole my system. I ought to kill him.
Yeah, well, what about killing his clients?
That would be bad for business. Computer kills homeowner. Film at 11. Now, what do you gotta think? Bruce's butler did it? Or that any system on the market is suddenly suspect?
The same could be said for Bruce. Accidents wouldn't do his business any good either.
I'm talking about a rational human being. You're talking about Bruce Locatelli.
Why would he murder his own clients?
Why does a guy climb a bell tower and start shooting?
No more swimming pools, Hal.
I understand, Bruce.
Let's turn our attention to our next target, Jerry Tam. Where does he live again?
Jerry Tam lives in Montreal.
Cold weather climate.
That is correct, Bruce.
He sneaks his smokes in the shed.
That is correct, Bruce.
Full screen, please, Hal.
This was captured yesterday. There is a handyman's workshop in the garage, complete with a sink with running water. These propane tanks are connected to a heater.
Propane?
The heater is on a thermostat. The propane is computer controlled to turn on whenever the temperature drops below freezing.
To keep the pipes from bursting.
That is correct, Bruce. Jerry Tam comes into the shed every evening at approximately 5 p.m. Eastern Time.
I see.
Which would not be a problem unless...
Unless the pilot light were out.
Is that a command?
I like this is the type of thing I'm looking for.
Oh, okay.
These are this color, but not. Yeah.
Go ahead, try it out. Call me Phil.
What's your real name?
Philippa. So, are you shopping for a few things for Dad?
No, actually, we're shopping for my son. He's bought a new house. Got tired of living with the old man.
I don't think she needs to hear our entire family history, Dan.
It's actually one of the great things about owning a store like this. You get to learn about such intimate details of people's lives.
Well, I'm looking for a couch, armchairs, a coffee table.
Okay. Well, then by all means, sample the merchandise. So do you have any particular colors in mind?
Well, this puce is nice.
Okay. Does it go with your home's color scheme?
I don't think it has a color scheme.
My, you are first time. And an available bachelor.
That obvious?
Been shopping around for long?
Not for furniture.
411. Meantime, on the 405, that SIG alert is still in effect at Slauson, and if you're on the 5, it is tough.
Code 3 coming in. Toxic suffocation.
Had this happen?
The windows were locked, the bedroom filled with smoke.
Vitals.
BP's 90/50. Pulse 110 and Freddie. Respiratory rate of 58.
Is there any blood drawn at the scene?
Yes, sir.
Let's get him into trauma 1. Get that blood for CBC, electrolytes, lactate level, and carboxyhemoglobin. Get me an intubation tray with an 8mm tube, page respiratory for some stat ABGs. I want to start another line in the other arm and get a stat portable chest film.
Got it. I'll call
What were the presenting symptoms?
Suffocation due to smoke inhalation. There appears to be upper airway edema. I'm having a tough time visualizing the vocal cords. I can't see what I'm doing here. We need to do an emergency trach.
He's arresting.
200 joules.
200 joules. Start.
Clear?
Clear.
300 joules.
300 joules.
Clear?
Nothing.
We've lost him.
Good?
I hope so.
Oh, that's nice. Just as uncomfortable as it looks.
Steve, you've got great taste.
Yeah, see?
You remember when we first moved to the beach?
Yeah. Carol started crying the minute she walked in the door. Said, this isn't our house.
So he took her by the hand and said, let me show you what we can do all by ourselves, and took her right down to the beach.
You weren't worried?
No, Catherine did enough worrying for the both of us. And I told her Steve wasn't going to let anything happen to his little sister.
I couldn't have been more than 11 years old. Sloan here.
Steve was always so responsible, even when he was a kid.
Yeah, well, things were safer then.
Oh, I don't know. Sometimes I think we just know about the dangers more now.
Yeah, maybe.
You all right?
I was just thinking that, we should have been able to save Bruce Locatelli.
Bruce Locatelli's computer has a full record of what happened.
Malfunction?
No, somebody compromised the system from the outside.
Somebody deliberately turned off the pilot?
Afraid so.
But who?
It's got to be his competitor, Donald Purdy.
So then Purdy murdered Bruce.
Looks that way.
Bruce said that Purdy was out to get him.
Yeah, still, I am so sure that Bruce himself was behind those two murders.
Well, Cheryl's picking up Purdy now. I got to get back to the station.
What kind of police state you running here?
Mr. Purdy's been read his rights and refused a lawyer.
Oh, I got a lawyer, all right. Good one. Gonna sue you blind.
You're facing multiple murder charges, Mr. Purdy.
I wasn't anywhere near Brucey boy.
No, but his computer indicates an illegal intrusion initiated by your system.
That's a lie.
There's a printout. Take a look.
You set me up.
Sit down, Mr. Purdy.
The hell I will. First, your stormtroopers come into my place of business.
You either sit down or I'm going to have to cuff you.
Why don't you shoot me while you're at it?
You're under arrest.
You all right?
Yeah, I'll live.
It was self-defense.
Yeah? Try assaulting a police officer. Come on.
Steve said Purdy just hauled off a hitter. Thought the man was all bark and no bite.
Well, bullies tend to be cowards.
Cowards how?
Look at the way he's killed. From a distance, never confronting his victims.
Yeah. Still, somehow I just don't feel right about it.
Dr. Bentley, I don't know what to do next. Do you know what to do, Dr. Sloan?
About what?
Well, I've been trying to notify Mr. Locatelli's next of kin. First, I tried all the Locatellis in the Los Angeles phone book, all one of them. Then I tried using that new national service. Nobody named Locatelli's even heard of him. So then I tried using the internet, hoping to find some relative in Italy, maybe.
You can find people in Italy?
Well, yeah, if they've got email, only they don't have email, I mean. If they even exist.
I think I know somebody who might be able to help us out.
He's had these photographs here since he moved in.
You know who they are?
Mr. Locatelli, he would not speak of them. When a man does not want to speak of Those he loves, it's best not to ask. It is my fault he's dead.
Why'd you say that?
Every day I come exactly at 7 o'clock to make Mr. Locatelli's breakfast. But this day there was a lot of traffic. I'm never late. But on this one day, if I had not been late on this one day, Mr. Locatelli would be alive.
My boyfriend couldn't believe I wanted to work with dead people. I mean, I'm sure you've heard it 1,000 million times, right? What can you do to help a dead person? Well, I said, I'm sure you say the exact same thing. I said, live people only cause you trouble. Dead people just lie there while you find out all their secrets. Don't you agree?
Mm-hmm. Dr. Bentley, do you have those autopsy results for Dr. Horowitz?
Yes, Ellie, would you get in the McDougal autopsy report, please? Cause of death was septicemia brought on by meningococcal infection.
I know. I put it somewhere.
Try the file cabinet.
I was going to put some files into storage, but for that I needed a box. I had the file in my hand. Didn't want to put it with the chemicals. It didn't belong with the medications either. I mean, then we would never find it. I was going to put it next to the computer temporarily, but then the phone rang. You weren't here, so I just put it... here. I don't faint anymore.
Mr. Luca.
Oh, that's Mr. Locatelli.
No, it's not. That's Mr. Luca. I could never forget Mr. Luca. I was new on the job, and here was this sweet man. His son came in for a routine appendicitis. The boy had a ruptured aneurysm on the table, and I was elected to tell Mr. Luca that his son had died. I couldn't believe the depth of Mr. Luca's pain. I never thought I would understand pain like that. I was wrong.
Wrong how?
2 years later, my son died. God, I've never recovered. My marriage dissolved. My life, really.
Annette, forgive me for asking, but how did your son die? Was he at home?
He was back from college for spring break. Somehow he ended up in the garage with the car motor running. I still don't believe it was suicide. I don't. I'm sorry.
No, don't apologize. Annette, I have one more question I do have to ask. In the Luca appendectomy, was the surgeon Dr. Kravitz? Well, it may not be much consolation, but I can promise you that your son's death was not a suicide. Bernardo Luca did suffer a terrible tragedy. His only son, Carlo, got appendicitis. They brought him to our hospital, and during the operation, an aneurysm ruptured, and the boy died.
Well, that's nobody's fault. I mean, that can happen to any surgeon at any time.
Yeah, well, Luca didn't see it that way. He saw this vast conspiracy against him. He sued the hospital, the insurance company, everybody.
Wasn't there a mortality review?
Yeah, I chaired it, and the court threw his suit out.
And Nardo wanted justice.
Yeah, well, his son was dead, and his marriage, as often happens, fell apart. He was a man in a lot of pain.
I don't get it. I mean, if Bruce or Nardo or whatever his name was wanted to kill somebody, why not those responsible?
He wanted more vengeance than that. He wanted his victims to experience his pain by killing the children of those he blamed for killing his son.
So then Lana died because she was Dr. Kravitz's daughter.
That's right. Just as Annette's son died because she was a nurse at the operation.
What about the victim in Hartford? Would that be the child of the insurance investigator in the case?
Exactly.
What about Purdy? Did he know this when he killed Bruce?
You know, I think Purdy may be guilty of assaulting an officer, but not a murder. I think this whole thing was a diversionary tactic.
Pretty extreme way to get us off the track, don't you think?
Well, Bruce was not supposed to die. That pilot light went off exactly at 7 o'clock. Now, Maria, his housekeeper, always arrived at 7 o'clock.
He was counting on her to save him.
That's right. Only that morning, there was a bad accident on the freeway, and she was delayed for half an hour.
So then what you're saying is that we're dealing with a murderer who is his own victim.
You know, I think we should just be thankful this whole thing's over.
minute, Dad. Bruce's computer didn't kill those people. Bruce did.
Yeah, I guess you're right. Well, did your system cook all this Chinese food?
Actually, it was the Chinese restaurant around the corner, which seems to have forgotten the mushu pork. I'll go back.
Oh, no, this is plenty of food. Good, too. You know, takeout's very important for a man who lives alone.
Dad.
Men don't cook for themselves. I rarely do it.
Dad, it's not like I eat dinner at home that often anyway.
Why do you think I know every takeout place in Malibu?
Well, I'm very sorry to have disturbed you. And I'm very sorry for your loss.
Man, what's wrong?
I just pulled the pathology report on the Luca case, and a colleague of mine, Dr. Tam, did the autopsy.
Did he lose a child, too?
Yes. His son in Montreal an hour ago.
That's impossible. Bruce died yesterday morning.
Ellie's idea of an email alert.
It's not impossible.
What?
How'd the boy die?
He was smoking in a storage shed full of propane tanks.
You know, Bruce could have programmed the computer to turn off the pilot light.
So we've got a murderer who's still killing after he's dead?
Man, that pathology report, check to see everyone involved. See if they have children.
Jesse, oh my God. Mark shared that inquiry, and Steve has one of those systems.
Hello? Jess, I can't hear you. I've been on the phone all day. My battery's dying.
Here, use mine. Oh, I left it in the car.
Jesse, let me call you back from a payphone.
I'll go get it.
No, don't let your soup get cold. There's a payphone at the Chinese restaurant. I'll just call them from there.
You sure?
Yeah. Being a true test of good Chinese takeout's mushu pork.
Right.
This will only take a minute.
All right.
Jesse, relax, okay? You're making me nervous. As long as Steve is out of the house, he's not in any immediate danger.
Steve!
Computers.
Your dad still inside?
Yeah, computer seems to have triggered the security system in the study. Called for a battering ram and a blowtorch.
This may take a while.
We may not have a while.
What do you mean?
The system is designed to pump fresh air into the room. If the computer's been programmed to cut off the air intake, we may not have much time at all. Is there any way you can hack into the system, take control of this thing?
It's way beyond my capabilities. You need somebody who knows how to backdoor
Purdy.
He's been released on bail.
I'll find him. I know. Why are you running?
Why are you here?
I need you.
What was that? Did I just hear you say, let's make a deal?
What do we need to do to hook you up?
Just stand back and let me work. In the system now, if I can just find the override.
What's the status inside?
We've made no contact yet.
For a lousy thief, that Bruce was one hell of a programmer.
Just tell us you're better.
Of course I'm better. I'm in.
All right, get some oxygen in there.
Oxygen level is nearly normal.
Let's go.
Dad?
I think... But don't try and talk.
You're gonna be just fine.
Let him work, Steve.
Jesse says you're going to be fine.
Takes more than a computer to kill me.
I found that.
Oh, yeah, it was...
I figured you were just reminding me to get an extra fortune cookie.
I figured that out. Now,
I am a detective.
how's the house?
Well, a few $1,000s worth of repairs. It should be good as new. I'm going to rent it out. Make a good investment.
You don't want to live there?
Well, it's kind of lost its charm. Of course, I was hoping my former landlord would let me move back in.
Well, your former landlord might raise the rent, too.
Oh, how much?
2 dinners a week?
I can afford that.
You know that pew sofa?
Yeah?
Don't bring it.
No.